Hi, are you having weird traveling pain or pain that just doesn't make sense? We're getting quite a few patients with that exact thing, and I just wanted to make this quick video on some possibilities. For example, if you've had some shoulder pain, it's likely or possible that you probably experienced it kind of going to your elbow or even to your neck. And a lot of that is because pain is an experience that travels or communicates through our nerves. And our nerves are all throughout our body. We have over 400 nerves in our body. And so when we have shoulder pain, a lot of times our neck can be involved in the pain experience or even the elbow, but they're perfectly fine. I want to use something from this packet here. Some of you may have, when you came into the office, I've gone over some of this stuff. This is a curriculum based from Dr. Adriaan Louw on pain neuroscience. And the pain neuroscience lesson that I want to go over today is called Nosy Neighbors. So the illustration goes like this. Imagine if your house alarm went off in the middle of the night and it kept going all night. Well, imagine what your neighbors will experience. Well, your neighbors are going to get irritated. They'll probably wake up and they'll get nosy about what's going on over at your house. So much like that, our nervous system is like our alarm system. And when pain is on, the alarm system is turned on. And so imagine if you had long-standing shoulder pain. Well, your neighbor, the elbow, the nerves that go to that elbow, will get nosy or irritated as well and start to also experience some of that pain, even though the elbow is perfectly fine. Same thing with your neck. The nerves that go to the neck will also get nosy because the neighbor next door, the shoulder, is irritated and the alarm is on. I think that's helpful in understanding through neuroscience education that even though there may be something wrong in the shoulder and you experience it in the neck, it's not the neck. So that can be very troublesome, right? So a lot of times I tell people your pain is very confusing and sometimes it can be a very big liar, meaning it tells you one thing but it's not there. And so a lot of times we don't chase pain in the clinic. So you may have long-standing pain and I'm looking more for motion, strength, and function rather than just chasing your pain all the time. And there are times when we do because, for instance, when you have tight traps, well, that pain is being generated there, well, we're going to treat the trap. But most of the time, if you have long-standing chronic pain, we're looking at more like function, mobility, how can you move, and what does your strength look like in the area, and then pain will go down as we treat those areas. So I want to encourage you, if you're discouraged because your pain is traveling, you can't explain it, doctors are telling you, I'm not sure why it's doing that. Well, this nosy neighbor illustration is very helpful, and because the nervous system is all across our body, there's 400 nerves, the alarm system turns on in one area, the alarm system can be triggered in another, even though there's not much going on or wrong in that area. So I hope that helps, and if you have any questions, please contact us. And if you are having trouble with weird traveling pain, come in and see us and we'll be happy to help. Thanks.